Welcome, everybody. I'm Brian Houts. I know most of you, great to see you here. Thank you for taking time with us today. This is Benj Four, who many or most of you know. Benj and I are both partners of Frazier Financial and advisors, and excited to talk about the world's most interesting topic, Medicare. Maybe not the most interesting topic, but it's a good topic. So without further ado, we'll dive in. If anybody has tech issues, you are welcome to call our office. And as much as we can, we're happy to walk you through any trouble. So big thing we're going to talk about today. This is the Irma bomb. I'm sure there's a bunch of people on the call who know exactly what I'm talking about. There's probably a bunch of people who don't. This is our clip art bomb that is burning a fuse here. So this is perhaps the most common planning item that comes up for us related to Medicare. And it's certainly one of the more frustrating components that we hear from clients. So as a preview to what we're going to talk about, there is essentially a means test to what you pay for Medicare. And that IRMAA that you see, IRMA, is the income related monthly adjustment amount. Kind of like RITA. Many of you have dealt with RITA for tax matters. I don't know why all the nasty financial things are named after women. That's just a bad industry thing, I guess. But IRMA is more or less a penalty or a tax. You could use a lot of different words that apply. So what you can see in this chart is these are income levels. On the left would be an individual. In the middle would be a combined income of a married couple. And essentially, if you make too much, if there is such a thing, you pay more for your Medicare. So this bomb is a huge planning component. We spend a lot of time helping clients go through this. Chip's going to touch on it in his presentation. A little preview for what's coming down the pike. As an introduction to the speaker today, Chip is our speaker. He works with a local group called Seniority Benefits. They are Medicare benefit advisors. We highly encourage clients to work with somebody who has deep knowledge around the Medicare system. We know a lot of the financial planning aspects, but we want you to talk with someone who knows more the insurance and benefit side of the house. So we have some bullet points there on the left, why you should work with a Medicare advisor. Certainly, as you choose Medicare advisors, you want to think about things like their compensation, their service level, if they're an independent agent versus a captive agent, meaning if they're agnostic in how they help you select benefits. Seniority Benefit Group is kind of our favorite partner. They don't pay us, we don't pay them. We just trust them to take care of folks that we send their way. The woman on the bottom right there is Carrie Quick. We've known her a very long time, have a great long working relationship. And then the gentleman you're going to hear from today is her peer and partner, Chip Lawson, is our special guest. I'll let Benj introduce him.
Yeah, thanks, Brian. Yeah, so worked with Chip closely for the past couple of years, and he's been a great partner. And if you are approaching 65, you are probably getting a lot of pieces of mail or phone calls around Medicare. And Chip's been a great partner to kind of cut through that noise and give kind of customized solutions to your Medicare needs. So Chip has been with Seniority Benefits for, I think he joined us in 2020, and Seniority Benefit serves 23 clients in 20 different states.
23,000 clients.
23,000 clients
23,000
in 20 states. As an advisor, Chip helps clients enroll in Medicare, understand the basic principles of Medicare, and assist them in finding a plan that's customized to their situation. Chip focuses on the client and often reminds customers that his recommendations are based on their personal situations, not their neighbors or what they see on TV. Chip works as an independent licensed agent, so he's able to discuss the different plan options that are available in the area. Includes supplemental plans, prescription drugs, and Medicare Advantage plans. Prior to joining Seniority Benefit Group, Chip worked in the medical device industry for over 30 years, working with surgeons, hospital administrators, and other healthcare professionals, assisting them to have better outcomes with their patients. When Chip is not working, he enjoys traveling, cooking, as well as spending time with his family and 2 Italian Greyhounds. And as mentioned, Chip's been a great partner for us and excited to hand it over to him.
Benj, Brian, thank you. Greatly appreciate the invite from Frazier, and welcome everybody. Thank you for joining us. Today, we're going to be talking mostly about the educational aspect of Medicare. I find that by taking a little bit of time and helping everybody understand these basics, what's A, what's B, what's Part A, what's Plan G, what are all these different letters that are being thrown at me, taking the time to help you understand that as we get into the real nitty gritty of plan decisions and plan types, it makes it much easier to understand. I remind everybody, I'm speaking Greek to you when we first meet. You don't speak Greek, I've got to teach you some Greek. So that's what I like to do. I sit down with everybody to help you understand what these basics are, develop a timeline, understand those basic rules, and literally helping you with all those A, B's, and C's. Go ahead and flip to the next slide. So you're 65 and you're considering retirement, or maybe you're past 65 and you're considering retirement. What are the next steps? That's the first question that pretty much everybody asks. Well, the answer to that is it depends. It depends on your particular situation. Are you still working, or is your spouse working and you're on a plan at their work? If that's the case, understand that it's not compulsory to make that move to Medicare at 65. You can delay that decision down the road. As long as that employer has at least 20 employees, you can hold off on that. It doesn't have to be done right when you turn 65. Probably the biggest misnomer out there is I turned 65 and I have to sign up for Medicare. Well, not if you're working, or again, if your spouse is working. Now, some people could be working and maybe to sign up for Part A. We'll get into that in just a moment. But again, the situation is all dependent upon what current plan that you have right now. What health insurance do you have? If you're turning 65 and you're not on a plan, maybe you're on Obamacare, ACA, or something of that sort, then know that at 65, you do need to make that move to Medicare. We'll talk about those enrollment periods in just a moment. All right, go ahead and flip to the next one, please.
Chip, I'm going to throw a housekeeping comment out here for everybody. We do encourage you to ask questions as you go. Chip has encouraged that, and we're all happy to dive in and break this up a little bit. There's also a Q&A box within Zoom, so you're welcome to submit questions through there, and then we'll kind of organize them, and some we may take down as we talk, and we'll leave time for Q&A at the end too. So don't be shy. Throw any questions you have into that Q&A box.
So just to tell you a little bit about Seniority Benefit Group. So we are a Medicare advisor firm, a guidance firm based here in Central Ohio. Our focus is strictly on Medicare. Our entire team is licensed, certified with a number of carriers in town. We're independent. We're brokers. We can see everything that's out there that's available in the area. We're licensed in about 18 states right now. We were at 20. We've dropped a couple, but we're at 18. And again, we're independent, which means that when we're sitting down, we're not trying to get everybody to fit into one particular plan. We're looking at those plans that are available to see what plan lines up best with your situation. I'm not biased towards a plan type. I'm not biased towards a company. It really comes down to your situation, how you like to tackle your healthcare, your finances, your list of providers, your list of medications, all those come into play on that decision. But when we sit down, we're first really showing you all these different options that are out there. The basics of them, not going into explicit detail on every one, but showing you what those options are, and then allowing you to make that decision. We can't make the decision for you, but what we will do is give you all the tools and resources, and we'll help you make that. I'll play devil's advocate with you, not because I'm pushing one idea or another, but what I want you to do is be thinking about, if you go in one direction over the other, what are the benefits? What do you lose as a result? My goal is to help you understand these basics of Medicare, develop a timeline, get you enrolled in Medicare, getting that A and that B, picking that plan, and then enrolling you in a plan. So those are the steps that we go through with each and every client. So we're talking about Medicare Part A and Part B here, and that's what this slide shows. So understand that there's two parts to Medicare. Think of Part A as hospitalization. I like to call it the inpatient side. Part B is the outpatient side, okay? It's the easiest way to think about it. So if you go into the hospital, you get admitted to the hospital and you're spending the night in the hospital or a skilled nursing facility or even hospice, that will fall under Part A. Part B is practically everything else. Again, it's the outpatient side of things. So this would include doctor visits, outpatient surgery, emergency room, labs, radiology. All of that falls under Part B. It's really the crux of what we use our healthcare for. When it comes to the cost of the two, if you've worked at least 40 quarters, it could be 10 years, 40 quarters, however you want to look at it. If you've worked that, you've already paid for your Part A through payroll deduction. So there's no cost to Part A moving forward. Part B, though, has a premium to it. The base for Medicare Part B is almost $203 a month for 2026. Last year was $185. This year it's $203. These numbers are decided upon by the Center for Medicare and Medicaid Services. We have nothing to do with this other than to report what they're coming back with. Okay. So when you're enrolling in Medicare, you need to enroll in both of these parts. If you're moving totally over to Medicare, making that transition totally to Medicare, you need parts A and B to enroll in a plan. If you're still going to remain on your plan at your employer or your spouse's employer, then some people will sign up for Part A only. Again, Part A is the inpatient, the hospitalization. Why do they do that? Well, a couple of reasons. Number one, it more or less gets your foot in the door. Also, your Part A, that hospitalization, would be a secondary insurance to your employer plan. So if you did get hospitalized, you might have some extra benefit that would be paid as a result of having that hospitalization Part A. Again, there's typically no cost to that Part A because you've already paid for that through payroll deductions. To enroll in these plans, the easiest way to do it is to log into your Social Security account. So I'd advise everybody, if you do not have a login for your Social Security account, ssa.gov, I would highly encourage you to get that done. The sooner the better. They made some major changes to this a few years ago. You used to log in your old-fashioned way of a username and password, and now they have separate ways to log into that. ID.me is one of them. So you just have to make sure that you're logging in and setting up that account.
Chip, I'll add a comment here. For any clients who've ever made IRS tax payments online, it's that same ID.me login. So that can be a pretty easy way to get in your first time. While we're on this,
I'm sorry,
sorry.
go ahead.
While we're on this screen, somebody was asking, how are those premiums calculated? Can you just riff on that for a minute?
Yeah, well, when we hit that slide on IRMA, it's going to explain that much, much better. But think of it that Medicare Part B cost is all means tested, meaning that the more you make, the more you're going to pay. It's the way the government does it. And so it's all based on income. What the government will do is go back and look at your 1040 with a 2-year look back. So for 2026, they're looking at 2024 income, specifically your AGI, line 11 on your 1040. It depends on how you file your taxes, if you're filing them jointly or you're filing them individually. But there's different levels. And again, when we get to that slide, it'll be able to talk a little bit better to that. But just know that it is means tested. The more you make, the more the government feels that you can afford to pay for Medicare. Right, wrong, or indifferent, that's how they do it.
How do they come up with the 202.90, the standard monthly premium?
I can't explain that. They have a number that's out there that you are paying for that Part B, for that Medicare Part B, that outpatient side. That's what they determine is that premium level. I've seen it go down over the last few years, and I've seen it go up. Typically, it's going to go up more often than it goes down. But that's a number that they base on what that cost of that Part B is per person. Let me just repeat one more thing here. Again, in terms of when you make that move to Medicare, it depends strictly on your situation. If you're 65 or older and you're no longer on an employer plan, you have to make that move to Medicare. COBRA is not even an option if you're 65 and you're not on that employer plan anymore. Okay, so understand that. We'll talk more detail about that if that situation arises with you. If you're working and you're still on that plan at work, you have the option of remaining on that plan. Now, oftentimes we do suggest taking a look at that to make sure that that plan is more equitable than what a Medicare plan would be. So if we see that you're paying high cost, $1,000 a month, or you have a $8,000 deductible, it might be worth looking at Medicare to see about making that move. We'll have those discussions with you. If there's that option of staying on that plan or making the move to Medicare, we'll do an evaluation of that as well. So when it comes to options, and this is for folks who are making that move to Medicare, know that you have several different options. It just depends on your particular situation. I'm going to skip over the first one for right now, but let's talk about continuing to work on your and keep your employer plan. Again, we just talked about that. If that makes sense and that plan has a better cost structure than what maybe making the move to Medicare, maybe it's worth your while to remain on that. Perhaps you have VA or TRICARE. You have a military background. Those are also good options for you. The other option is to enroll in your work plan, your union plan. A couple of options here in the state of Ohio would be something like STRS, state teachers, or OPERS, Ohio Public Employees, or school employees, SERS. If you're part of any of those, I highly encourage you to check with them first before you have any other conversations to see what you're eligible for. Many of those types of plans, you need to have 20 years, sometimes 30 years, to really get the best of what they're offering. If you have 15 years, so my wife worked as a teacher, she only had 15 years, so it didn't make sense for her to go to the STRS plan. So we decided to go a different direction. So just know that that's an option for you. Most people that don't have those options are going to make that move to Medicare. And again, that's where we're going to help get involved. Go ahead and flip to the next one, please. All right, so these are the two really major options that most people have. This is a major decision that you have to make as to which one of these two options you go with. Medicare Supplement, Medicare Advantage. Think of it this way, as a very general way of looking at this. Medicare Supplement plan is an extra plan that you're going to pick up that will have an extra premium to it. So typically you're paying on the front end via that premium for that plan. Keep the cost on the back end little to nothing. There's some other differences on it, but I want you to think about this at a 40,000 foot view. In a supplement plan, you're paying extra on the front end, keep the cost on the back end little to nothing. They also call these Medigap plans. It fills in the gaps of what Medicare doesn't pay. Versus a Medicare Advantage plan. In an Advantage plan, you pay little to nothing on the front end. Most of the plans are a $0 premium, $0 deductible, and then you just pay co-pays or co-insurance as you utilize those services. So Advantage, you're paying on the back end. Again, I'll get into much more detail on each of these, but just think of it that way. Another simple way to think about this, and I've used this for many years, it's a very simple analogy, but I think it really drives the point home. Think of Medicare Supplement as the buffet line at the restaurant. You pay one price, and no matter if you want to eat a lot or you want to eat a little, you're paying the same price. Whereas the Advantage plan is more like the a la carte menu. You only pay for what you eat. Again, very simple analogy, but I think it drives the point home. Really, what's the difference, between each of these plans? So let's talk about Medicare Supplement plans first. These plans, when it comes to these are very standardized plans. When you hear a supplement plan, and by the way, a Medicare supplement is a very specific type of a plan. It's not a catch-all phrase for all the plans that are available. These are very specific plans. These are all government standardized private insurance plans. So you're going to pick up a plan. You'll have an extra premium on top of that. You'll have an extra premium on top of that. And by having that premium, know that if you go into the hospital, and by the way, when it comes to these types of plans, they're always called plan with a letter, plan G, plan N, plan F, etc. I'm going to talk specifically today about a plan G. Plan G is probably the most comprehensive plan, at least for somebody who's born after 1955, that's available. It's the one that I would tell you 90% of our clients would enroll in. But when it comes to these kind of plans, if you did go into the hospital and you had a plan G, it's going to pick up 100% of your cost. Whether you go in for a day, a week, a month, it's 100%. Under the Part B side of things, remember that's the outpatient side, doctor visit, emergency room, outpatient surgery. You have one cost, additional cost, which is the Part B deductible. So there's a small deductible that you pay. For this year, it's $283. And then after that, Medicare picks up the rest. Between what Medicare pays and what the supplement plan pays, sorry, they pick up the rest in the two. These premiums are going to be based on where you live, on your age, on your gender, if you're a smoker. That's how those plans will be, the premium on those plans. When we look at these plans, I will tell you, we focus pretty much on the big boys when it comes to these plans. We want to get you into a supplement company plan that has a large number of people. It just helps to reduce that risk. So we'll be talking about these larger companies if this is the route that you wish to take. But again, remember, this is a very specific type of a plan. It doesn't matter which one of these plans you choose, Medicare Supplement or Medicare Advantage, you still pay that Part B cost. So that Part B cost does not go away. That's a standard number 2 that you would pay. Now, why do people go to these types of plans? What's the big interest in these types of plans, maybe more than Advantage? Well, I would say it's 2 things. Number 1 is these plans are easy to budget for. Your costs are pretty much fixed. You pay the Part B premium, you pay the Plan G premium, you pay that deductible, and you know no matter what comes your way, it's all going to get picked up on the health side. The other thing about these types of plans, it allows you to see any doctor, any provider anywhere in the country that takes Medicare. So you're not asking the question, do you take Humana? Do you take United Healthcare? Do you take Aetna? You're only asking the question, do you take Medicare? Remember, we're talking about Medicare plans. So the 2 boxes that you always have to check is, number 1, it's a Medicare covered service, and it's a Medicare provider. 99+% of the providers out there take Medicare. Now, that's the good news on the Medicare supplement side. Again, easy to budget for any provider you want to see that takes Medicare. The not as good news on this is that, excuse me, that premium will go up a little bit every year. As you get older, it goes up at a higher rate. As you continue, perhaps into your 80s, it'll go up even on a higher rate. So know that it won't stay right where it's at when you first enroll. The other thing with this type of plan is it only covers what Medicare covers. Now, Medicare covers a lot of things, but they don't cover things like dental, vision, hearing aids, those types of things. Those are extra out-of-pocket expenses that you would have if you were to choose a Medicare supplement. All right, go ahead and go to the next slide, please.
You want Advantage or you want Part D, Chip?
You know what, let's talk about Part D first, and then we'll come back to Advantage. So with a Medicare supplement plan, you would also need to enroll in a standalone prescription drug plan. These 2 are through private insurance companies. Remember, Medicare does not cover prescription drugs, so you would also need to pick up a standalone drug plan if you were to choose a Medicare supplement plan. It's a lot easier to talk about these once we have a list of your medications, but what I would tell you is that when we're looking at plan options, we're looking at your list of medications in that company's formularies to see whose plan jives best with your list at the lowest cost. There's two costs that are involved in Medicare drug plans. One is the cost of the plan, the other is the cost of the medication. So I'm looking at that combination, that total cost, drugs and plan, to make that decision as to which way you go. These are pretty much a black and white type of decision. Again, we take your list, we have software that will do all that work for us, and literally with the push of a button, we'll see which one of the plans lines up best for you. When it comes to these types of plans, the premiums can vary greatly. They could be a $0 premium, they could be over $120 a month. That decision, again, comes down to your list of medications and seeing who's offering at the lowest cost. All right, go ahead and let's flip back to Medicare Advantage then, please. Oh, one more thing to add on the drug side. For 2026, the max amount of pocket number, and this applies to drug plans too with Medicare Advantage, the max amount of pocket number for drug cost. This is just the cost of the medications. This is what you'd be paying at your CVS or Costco pharmacy when you go pick them up. The max amount of pocket number for 2026 is $2,100. That's something that they started last year. Last year it was $2,000, now it's $2,100. But it really has helped a number of folks who are on expensive medications to keep those numbers a little bit better in check. All right, let's go to Medicare Advantage. So what happens here in Medicare Advantage, rather than be looking at A and B now, and by the way, they call Medicare Advantage Part C. I don't use that a whole lot, but you'll see that in some places. But rather than Medicare controlling your cost and controlling your plan, now the reins are being handed over to one of these private insurance companies, all the big names that you're familiar with. And now they're going to manage your health care for you. Again, these are sold by private insurance companies. I would tell you many of these are probably very similar to your plans at work in the sense that you have networks of hospitals and doctors that you have to pay attention to. And then you have co-pays or co-insurance for those services as you need them. We'll get into details about that in just a moment. But I think these are very close to what most of us are used to with our employer plans or former employer plans. So rather than really breaking it down into A and B like we did on the supplement, now what happens is you pay for services only as you require them, only as you need them. So you would have a copay, a dollar amount, or a co-insurance, a percentage for that cost. And all those costs will add up to a maximum out-of-pocket dollar amount. That's the most you would ever spend in a given year. I would say an average on that right now is what we're seeing in the market is about $5,000 to $6,000. That's the combination of those copays or co-insurance that you would pay, again, on the health side for those services. To give you some ideas of what those costs would be, if you went to see your primary care doctor, you'd be paying maybe $5, could be $0. A specialist might be $40 to $50. If you go in the hospital, you might have a per diem cost of $400 a day. And you'd have to pay for the first 5, maybe 6 days that you're in the hospital. After that, the plan picks up the rest. There's a copay for an outpatient surgery, $350 to $400. So if you went and had an outpatient total hip replacement done, your cost for that procedure for that day would be that $350 to $400. There's a copay for the emergency room, $150. There's a copay for an MRI, $200. These are just some average numbers that I see, but it gives you some ideas of what those costs are. The costs are pretty decent that come with these Medicare Advantage plans. But what I will remind everybody is that these are more managed care type plans. So if you're on a plan with company X and you want that total hip replacement, then that doctor or that hospital, that provider needs to write a letter or make a phone call to that company to say, you need this procedure done for X, Y, and Z reasons. And then it has to be approved. Okay. So that's one thing. The other thing is you have to make sure that your providers are in the network. Is my hospital, Riverside Hospital, in the network? Is my doctor in the network? Now, we do all that for you. When we first sit down, we're getting that list of doctors and hospitals from you to make sure that everybody's in fact in that plan. But as you go forward and you're looking for a new dermatologist, let's say, you want to make sure that they're in the plan. These plans are available at HMOs and PPOs. As a reminder, in an HMO plan, you have to stay in the network. You can't go out of network. If you go out of network, you'll get no benefit. In a PPO plan, you do have the option of going in or out of network. Note that when you do go out of network, your cost will go up. Those copays will be higher, that maximum out-of-pocket number will be higher. So just know that it's always best to stay in network when you can, but the PPO does give you that option. Remember, in the Medicare Supplement plan, we're not dealing with networks. That's the big advantage there. The advantage here is that your plan is zero, so you're not making that monthly cost. You just pay as you go. Again, many of these plans that we see in this area do have a $0 premium to it, even a $0 deductible, which means that as you utilize services, you're going right into those copays. You're not having to meet the first $2,000 or $3,000. You go right into that copay. Last that I'll comment on this is that what we have here listed as a snowbird provision. So not every plan, but many of the plans will offer you a travel benefit, which means if you're going to live down in Florida, in Naples, Florida for 4 months out of the year, that you would have access to that company's list of providers in that area. So you would have that ability to go and see providers outside of your area. One thing to note too with these Medicare Advantage plans, if you're traveling the country and you're involved in an emergency situation, you're out in Colorado, you're hiking, you fall and you break your ankle, you go to the nearest emergency room or urgent care, and you're looked as though you're in network while you're being treated. So no, that's a Medicare rule. That's not a company rule. That's a general rule for all these Medicare Advantage plans. So you don't have to worry about that. It's what I'm referring to is getting follow-up care or just a general care if you're traveling within the United States. That's when we want to make sure that we have those travel plans. All right, let's go ahead and go to the next slide, please. So this gives you a good idea of just estimated cost between these types of plans. So as a general comment on these Medicare supplement plans, I would say about $160 a month for a supplement is a pretty good number. It's a little bit higher for a male, a little bit lower for a female. Right now, these are pretty much at 65 years old. Remember that Part B deductible that you have to pay, you pay no matter which plan you choose. Okay, so you know that you'd have your premium for your Part B, $202.90, if you're at that base rate, $160 for your supplement, and your Part D premium. We show $62 as an average across the country. I would say I would estimate that maybe a little bit lower for that. But as a general number, I think that $425 or so is a pretty good number to be thinking about of what your healthcare would cost if you went with a supplement plan. As opposed to a Medicare Advantage plan, one thing to understand about Advantage plans is when it comes to cost, it's all about utilization. The more you use it, the more you pay. The less you use it, the less you pay. So when we look at these slides side by side or look at these plans side by side, it's very difficult to really put a dollar amount on that Advantage plan because we don't know how you're going to use it for the year. Again, the more you use it, the more you pay. The less you use it, the less you pay. So if you're a big user of the system, you have a number of surgeries maybe planned, or maybe a hospital stay, or maybe you have infusions going on, something of that sort, probably going with the supplement plan would be a better alternative. By the way, I neglected to state one thing, and I apologize, under the Advantage plans. These plans also include extra benefits, things that Medicare doesn't cover, things like dental, vision. We talk about vision, we're talking about eyeglasses, hearing aids, over-the-counter meds, those types of things. Note that those are extra benefits that many of these Advantage companies will offer in addition to the plan itself. These extra benefits can be all over the board. You might get 2 cleanings a year on the dental. You might get $2,000 of dental. It just depends on that plan. And again, back to Advantage, what dictates more than anything which plan lines up best for you is your list of providers and your list of medications. All right, let's get into this IRMA slide next. This is a very busy slide. And what I want everybody to understand here is when it comes to the cost on that Part B, can everybody see the whole slide? Because I know on my end it's being covered a little bit. Can you guys see that, Brian?
Yeah, did that change it for you?
Yes. So what I want you to understand is a couple of things. Number one, the first question I'm going to ask is, how do you file your taxes? This is the only time they're going to be looking at you as a couple, as a family, is on this income number. Everything in Medicare world is individual, except when it comes to this. And this all comes back to how you file your taxes. And the reason I state that is because if you're married and you're filing separately and your income is up there, then note that if you see that third column where it says married file a separate tax return, you notice there's only 3 categories there. So if your accountant is telling you to file your taxes separately because you might save $1,000, be sure you're looking at what those costs are going to be for your Part B here, because you might end up paying an extra $3,000+ on your Medicare Part B as a result. So just look at that. I just want to make that comment real quick here. All right, so let's look at this first row. Let's look at married filing jointly. That's what most folks do, at least the ones that I come across. For this year, 2026, they're looking at 2024 income. The first level, the first threshold is $218,000. So if your income, your AGI, your line 11 or your 1040 is under $218,000, you'll pay that base rate of $202.90 for your Medicare Part B. $202.90. If you're drawing Social Security, that amount will get taken out of your Social Security check. If you're not drawing Social Security yet, they will bill you quarterly, and you can pay that quarterly. If your income is to the next level, 218 to 274, see that Part B goes up from 202.90 to 284.10. That difference between the 202.90 and the 284.10 is what's known as IRMA. That's the extra amount that you pay based on income. If you're filing jointly and you're both on Medicare, know that you'll both be paying that same amount wherever you fall here. One more thing to point out is that not only will they charge you extra for your Part B premium, they'll also charge you more for your Part D premium, the drug plan. It doesn't matter what drug plan that you choose, but know that the federal government will tack on an extra, in this level, in that second row, $14.50 on top of it. As you see, as income goes up, so does that number. So the third level is really the double. It's the double of the 202.90. So 274 to 342, you know you're paying twice the amount. Then you can see what it goes to once you get above 750. You know that you're going to be paying pretty close to $800 a month for your Medicare before you even choose a plan. Okay. Brian, anything you want to add to the discussion about IRMA?
Yeah, as we mentioned in the beginning, IRMA is perhaps the biggest financial planning related detail of Medicare. And so our clients are often hearing from us about things like Roth conversions or the cadence of spending down an inherited IRA or your own IRA or 401k. So those are all things that we look at frequently. For all the clients on the call, when we're looking at financial planning, we think of this IRMA as an additional tax. If we tell you, Your tax cost on a conversion is 18%. We're baking in this IRMA and making it as if it's an effective tax rate. So this is a huge, huge planning topic. Chip, we had a great question come in that comes up a lot. Libby asked if there's ways to get around a one-time spike or a one-year income spike. And we've done some work on that with clients. Can you talk about any potential to appeal having a irregular year of high income?
So if it's a regular spike and it's just due to sale of a house, or perhaps there was a death benefit that got paid, I don't know of any way to get around that. But if your income, so let's say you're retired, you just retired at the end of 2025, and your income was $250,000, which is going to put you in that second category. But now you're retiring in January, and now you know that your income, because you no longer are getting that income, the only money you're making are from your stock options and those kind of things, IRAs and such. Then obviously your income is going to go down, and you do have the ability to appeal that decision. I highly encourage everybody to appeal it if you have a life-changing event, which is loss of job, loss of hours, loss of spouse. Those types of things will come into play. And so you can, in fact, go in and apply for that appeal. So what you're going to want to do is then to get together to decide what is that income number going to be for the new year. So if you were, again, at 250,000, now you're retiring, maybe your income is going to drop down to half, so 125,000. That means that you would go ahead and be moving from that 284 number to that 203 number. I encourage everybody, if you are appealing it, when you do get that bill, go ahead and pay that bill to whatever has been sent to you. Pay that. And then if they do find in favor of the appeal, they'll do one of a few things. They'll either credit you for future months, or they'll send you a refund check to do that. But just so that there's no issues going on with your Medicare in those first few months, I would encourage you to pay that bill. Just know it will be credited down the road.
We can also help with that. So if someone's in that situation, certainly reach out to your primary advisor. We have some letter templates we've used in the past. We've had some success. Ben, I know you've worked on it. Things like a home sale or a business sale, if I remember right, we've had some success getting through those. Non-qualified deferred comp plans, we have not really had success calling those, unusual income events, but we can work through whatever your situation would be.
All right, so let's go ahead and flip to the next one here. So this is the enrollment periods. And again, as we sit down, we'll be talking about all of this. But what I encourage everybody to do is approximately 4 months prior to making that transition to Medicare, please reach out to us. That's when we want to start that conversation. The enrollment period, when you're turning 65, your initial enrollment period is the 7 months around your birthday, 3 months before, 3 months after, in the month of your birthday. That's when you can enroll in Medicare if you're making that move. So let's say you're on the ACA, and beginning April 1st, you're turning 65. You could, in fact, go ahead and enroll in your A and B now, 3 months prior to. Again, you can do that online by logging into your Social Security account. If you're waiting, you're delaying your Medicare till later on, then you have a 3-month period prior to that retirement date. Obviously, we want this new plan to start as soon as your current plan, that employer plan, ends. So we have a 90-day window there. Again, going back to calling 4 months prior to is just the perfect timing for you. But when it comes to delaying and making that move, just so you know, because you're going to keep hearing people talk about, well, if you don't do this, you're going to get penalized. What happens if you delay that enrollment after 65? When you go to enroll in Medicare, there's a separate form that'll have to be completed by your HR folks at your employer. And what that's going to do is it's going to explain to the government that you've been on a qualified health plan since you turned 65, if not before. And that's how you keep from having any kind of a penalty. So we address that at that time of retirement.
Chip, what about Part D? Is there penalty or any harm if you don't take it at 65 and want to take it later?
Uh, it- that's a good question. It depends upon the plan at work. As long as that plan at work is looked at as though it is equivalent to, if not better than, a Medicare plan, then you can be on that drug plan at work. What I would tell you that I hear this from a lot of folks who maybe aren't taking any medications, or maybe they take just some over-the-counter type of things. And what they want to do is not pick up a drug plan, not enroll in a drug plan. Well, if you don't enroll in a drug plan, then what will happen is you'll get penalized down the road when you do sign up for a drug plan. So I encourage you, because there are $0 drug plans that are available, I encourage everybody to go ahead and at least sign up for one of those so there's no penalty down the road.
We have some good questions coming in, so we'll do Q&A on its own here in a minute. But importantly, Chip, how do people get a hold of you and work with you guys?
Yeah, so there's a couple of ways to get a hold of us. Obviously, you can just call our office and ask for me. The number's right there, the 614-799-1403. You can dial 0 for the operator and have them transfer you to me, or you can just dial extension 236. That's me. You can also go to our site, which is www.sbg65.com. You'll see all of us that work here, and you can also send information that way. Or if you even want to scan that code that's right on there, if you put your camera up there and scan that, that'll pull right up and get things started for you. What you'll actually see there is the ability to go in and fill out a form to request us to get in touch with you. One of the things that I certainly want to remind everybody of is there's no fees for our service. We do get paid by the insurance company, whatever company we sign you up for. This is all federally regulated. The cost of what the commissions of what they pay us are almost identical. So there's nothing in it for me other than making sure that my clients are taken well care of. We're here to help. I think that's probably the best thing that I can explain to everybody today. We're here to take the guesswork out of this transition to Medicare. If we can help, give me a call, reach out to us. We'll be happy to help you. That's what we're here for.
I'll add to that what I said earlier. Frazier Financial does not pay Chip's group and they don't pay us. This is just a relationship that we trust to take good care of folks. And in our experience with Chip and Carrie and others there, they'll also be the first ones to tell you when they can't help you. So I know they would encourage you to reach out. If there's nothing great to be changed, they'll give you some good, honest advice and get you in a better place. So with that, we can field a couple of these questions that haven't fit in quite yet. There's Chip's contact info. If you have your phone up doing the QR code, just take another picture there of all that contact info. You can also shoot us a note here. If you want to email your advisor, we'll get you in touch with Chip and his folks. Chip, a couple of questions that I think are good for the broad group. A couple of people asked about international coverage. So in any of these Medicare plans, can you get a variety of healthcare coverages on your trip to Europe or Asia or wherever you're going in retirement?
Yeah, many of these plans will offer you some benefit towards international coverage. However, there's a big however, it's only for emergency purposes. So if you're in Istanbul and you have something going on and you have to go to the emergency room, it'll help you in that situation. But understand you're pulling out your American Express card, you're paying for it, and then you're going to work on getting reimbursed when you come back. It depends on which plan that you're on, but I would say that $40,000 to $50,000 basic number is what's available to you. Again, if you get released from that emergency room and now you need to go get follow-up care, it's probably not going to cover that. So we highly encourage folks to pick up a travel benefit while you're traveling through Europe or Asia. The cost on those plans are not bad at all. My wife and I went to Italy this past summer for 2 weeks, and I think the cost was just under $250 for the two of us. I think it was $1 million plan, 500,000 or a million. I don't remember, but it was more than enough to cover us. And as we've all gotten older, when we were 35 years old, we didn't think about these things. Obviously, now we're older and we have different health situations going on. We highly encourage folks to pick these.
We had another good question from somebody who has already gone through their Medicare selections online. If you're between the date of your enrollment and the date it's effective, can you still go in and make edits and talk with you folks?
Yeah, you could, if you haven't started the plan yet, you can typically disenroll from that plan. So that's something that can be done. Some of it depends on what plan that you in fact sign up for, but typically if the plan has not started, you can still disenroll from that and then do a redo. If you're on um, there's some different rules that are associated with Medicare Supplement and Medicare Advantage as to making those changes. Just know that changing from a supplement plan to a different supplement plan outside of that window typically is going to require medical underwriting.
Got it. Chip, something that comes up a lot for us, and there's a couple questions here today. What about healthcare coverage through the exchange, ACA credits? Do you guys work in that space, or do you have any advice on folks who do?
Yeah, we do have a gentleman here in our office that will help with ACA. And so if that's the case, because we see this a lot of times we'll get somebody, a couple that just retired. One of the spouses is under 65, the other one's over 65. So we'll get that one moved to Medicare. And then we'll have Cam in our office help with the under 65 to find another plan. And also evaluate, is Cobra an option for you? Is that a better way to go? What's the option here? What's the best option for you?
And certainly our team can be involved in that. And I see the folks who are sending notes, we've talked about it. We can help figure out what your income is going to look like until you're 65. In some cases, the way we manage portfolios, we can even control your income to some degree and ramp it down, so to speak, for a few years. And then at 65, you don't have quite the incentive to keep your paper income very low. So there's a lot of nuance there. And if you talk to Chip's group or others, certainly get us involved in that tax planning conversation. This is a niche question, Chip. I'll hit you with it. A client said his exact Part B letter for next year has a different premium than what you're showing. Do you have any wild guesses how people might see different amounts?
Oh boy. My Part B cost is 147.90, not 202.90. I don't know. I honestly I can't explain that. I'd have to see what that letter says. I'd want to see that letter to be able to speak to that.
Well, I see that came in from Bill. We'll get you guys in touch. It's always good when we can stump the speaker. So I'm glad we had a good question today. Let's see what else is on here. Cheryl has a great question. I know you touched on this, but how far ahead of enrollment, that 3-month window you talk about, how far ahead of that can they, or should they get in touch with you?
Yeah, I stick by that 4 months, 4 months prior to that start date. Everything in the Medicare world starts on the first of the month. So if your birthday is March 15th, know that that plan would start March the 1st. So 3 months prior to that. Oh, sorry, 4 months prior to that. 3 months is when you can actually go in and enroll.
Chip, one other question here. It's around HSAs.
Mhm.
And we're big fans of HSAs and encourage everyone to save there. Could you just briefly speak to how HSAs interact with Medicare and what HSAs can be used for once you are on Medicare?
So yes, HSAs are great options for everybody. If you are contributing to an HSA, then you do not want to take Part A, because once you take A and or B, you no longer have the ability to write off that deduction, that contribution. And so now, if you're the person that's on the plan at work, your spouse can still sign up. You would not want to sign up for that. So the other thing that I would encourage you to do is at least 6 months, if not more, prior to making that move to Medicare, to stop that HSA contribution. This is especially comes into play if you're delaying that transition to Medicare. Okay. If you're signing up for Medicare because you're turning 65, let's say in July, knowing that you're going to want to stop that contribution effective at the end of June. Again, as a result, if you are doing that, you may end up paying a penalty, or you can pay that back so that you don't pay that penalty.
And then once you are on Medicare, you can use your HSA.
Oh, thank you.
what?
Sorry. Yes.
Yeah.
So HSAs can be used to pay basically many of your co-pays. It can be used to pay your Part B premium, your drug cost, your dental cost, all those types of things. The only thing that I know of that you can't use it for is to pay that supplement premium.
We have a good amount of clients on here that are still 1, 2, 3, 4 years away from Medicare. So as Ben said, we're huge HSA lovers. We should have HSA t-shirts or something. And some of those savings in your late 50s or early 60s can end up being this really tax advantaged way to pay those Medicare premiums, or really in effect reimburse yourself for them later. So if anyone is fitting into that bucket and hasn't talked about HSAs, just shoot us a note. We can get you detail there. Chip, we got a couple questions around which states you're licensed in. So I may just put some of these folks in touch with you directly, and we'll figure out if you can work with them. And if not, we'll make sure we get people resources in their state. The Office for Seniority Benefits, for those of you here in Columbus, their office is catty corner to Bridge Park. So if you've ever gone up Riverside Drive, you've gone right by it. And just like Frazier Financial, they work with clients in lots of states, and so we'll make sure we connect all those dots for everybody. We got a couple questions that are really detailed and specific, so we'll reach out to some folks where this Q&A here, I think, is a really individual conversation. We'll make sure we get some good answers to those folks. We're coming right up on time. Chip, really appreciate you joining the call and lending some expertise here. And we may have some follow-up questions, and certainly we'll encourage people to reach out to you. For all the clients here on the call, we appreciate the time that you took to spend an hour with us, and you've got Chip's contact info. As a reminder, we're going to put a replay link of this whole webinar on YouTube. It takes a week or 10 days to get that made, and we need to run it through compliance. So give us maybe through the end of the week after next, and we'll make sure that's in your inbox. And then you can go through and take detailed notes and screenshot and so forth. As always, if you have questions, you can reach out to Frazier Financial through any of the ways on the screen. And certainly your primary advisor is the best person to start questions with. And with that, we'll wrap it up. Chip, thank you again. Sure, we'll be talking to you soon.
Thanks, everybody. Appreciate the invite.
Have a good day.
Thanks.
Care.